Today on AI Applied, you know that we love talking about AI in the healthcare space. Jaden has usually done some kind of crazy research on this, and he and I were talking offline about Huma, if that's how you say it. But AI and generative AI in healthcare is absolutely huge. This is literally going to save lives. And the big news coming out of there just recently, I think it just came out yesterday, if I have this right. But Huma raised $80 million to turn text into healthcare apps with generative AI. There's also a tie-in kind of with what Jaden is doing with some of his startup products and things like that. But let me kind of kick it over to Jaden here. And Jaden, what are you seeing about this? What was so exciting too? Because you were chomping at the bit to talk about this story.
Yeah, no, I think this is exciting. Obviously, I'm huge on these kind of like, I don't know if you call them micro apps, but definitely these kind of like GPT store kind of things. For those that know me, I'm building AI Box, which is like a no-code AI app builder marketplace. So it's got a lot of similar things to this. This is obviously just specifically focused on healthcare. So kudos to them. And I think this is a smart move to kind of go in one very tight niche and kind of niche down and give some like custom tools there. I think that they can see a lot of value in that. That being said, I think this is a really cool tool. I'll give you an example of like what the heck this is actually used for.
Yeah.
So they have an example where essentially you go into the dashboard, you can click generate an app with AI. And essentially all you have to do is describe your app, and it's going to allow their Gen AI technology to create an app for you. And the example they gave is someone saying, build an application with a clinical dashboard for remote heart failure monitoring, include relevant devices, ePros, and content. And it's going to spit something out for you. They have a couple examples as well, which is like general oncology app, heart failure app, IDB app, post-op monitoring, AF monitoring, obesity management, all sorts of things you can create. Now, I think this is interesting, and there's a wide range of users for this. This isn't going to just be like direct to consumer. Like anyone is probably going to be building these. These are probably for very specific clinicians
right.
and healthcare professionals. But I think this is amazing because right now we have this big barrier, and I love that AI is breaking it down, where there's all of these people with expertise. And this also is what I'm focusing on with AI Boxes, my thesis there. So why I'm extra excited about it. But there's all of these experts that are experts in their own area, but they have these barriers to entry between them and making software or apps or technology to help not just augment what they do, but help other people augment what they do. And so I would never go and try to build sort of heart failure monitoring application, because I don't even know everything that's required for heart failure. But if that is what your expertise is in, and you're a medical professional using this tool, you spit this, I'm thrilled to go use this. And all of a sudden it brings the cost down from $1 million to go develop a custom application for something like this to they're able to spit out all sorts of customized tools, see what their users like best. And it just really lowers the whole barrier to entry for these professionals and experts to get into technology and make really custom tools for their clients or for the patients. So that's what I'm excited about.
Yeah. I love that. And I think you said it really well there, which is it's all about the barriers to entry. And so when we think about what generative AI does, and this is obviously AI applied, but it's this ability to do a lot of things that you could never do before. So in this case, let me take you to sort of to NYU, for example. So what I do over at NYU Stern, I've been working with folks who are entrepreneurs and everything like that. And the reason is that when you're trying to build an MVP, and Jaden, you've done a few startups in your life, you have an expertise, like you, Jaden, for example, but there's a lot of things you can't do. I know you're not, probably like a big coder or a big finance guy or a big whatever it is, like app builder or whatever it is. You call in other people to do that. What generative AI is so good at is allowing you to at least get that minimum viable product going. And the thing about healthcare, as you say, and what I'm so excited about Huma about is that a couple of things. First of all, Huma's already a known brand. I was looking up, just as we were talking, Huma has doubled its revenue year on year, targeting profitability. It's been used in 3,000 hospitals and clinics, engaging and screening over 3 million individuals across 70 countries. This is already a trusted product. And now this is this new AI-powered cloud platform. But what this is going to be able to do is, to your point, take people who really have great ideas, who are on the front lines, who understand the industry that they're in or understand the problems or all that kind of stuff. The problem is the translation. You can have those ideas exist in somebody's head, but they don't know how have an app. And so they'll be sitting around the lunch table being like, what we actually really need is we need an app that does X, Y, and Z. And what Huma is going to be able to do, it looks like, which is a little bit what I think you're talking about with AI box as well. You want to just put this in the hands of everybody, is say, okay, let's take that idea and let's start creating a minimum viable product, which is essentially turning everybody into an entrepreneur and crowdsourcing and going where the knowledge is. And that's the real value. The value is where the knowledge is. But unfortunately, as we know in this world, the value gets diminished and there's so much untapped value because those people who have the value in their brains aren't the ones that know how to build this. It looks to me, correct me if I'm wrong, that Huma is breaking down that barrier in a really
cool 100%. So I'm excited. Anything that lowers the friction in healthcare, I'm excited about, but in technology, obviously more broadly, I think it's really good. So we're going to see some really positive outcomes. The one thing I'm not 100% sure about, well, it's kind of interesting. So Vedat, who's their CEO, kind of talking about it, he didn't actually say what models were being used to kind of power this whole thing. He said like, we're working with partners like Google to, develop a library of models, and they've been kind of working on that, but it doesn't necessarily outline it. I have two theories on why that is, and just based off of what I'm building. One is they're not like, if they built their own custom AI that did this and it was like, wow, this is epic, they would definitely be shouting that from the rooftop. So the fact that they're not doing that makes me think it might be more simple than people would think to put something like this together, and they might just be leveraging ChatGPT or something else. The only other reason I could think that, so I think that's the outcome, not to like diminish it, but like, I don't know. Sometimes I feel like it's helpful in the AI magical hype bubble to just like clear a little bit of the hype and say like a little bit of the magic and say this is probably how it's being done, so people understand it better. Also helps us to understand the limitations that it might come up with. And I'm sure they had to build a lot of stuff in because it's a regulated industry, highly regulated. But in any case, the other thing is they may be trying to perhaps avoid some of the negative PR that certain AI models have got. They said they have partners like Google, so I'm assuming there's a high likelihood they may be using something like Google Gemini, which has had a lot of flack in the past. And I just think it brings up this interesting point where, and I don't really care, whatever, I'm sure they're going to get their thing figured out. But I think it brings up this interesting point where technology companies or companies rolling some of these tools out, we might get to this point where they don't want to say what AI model or tool they're using because they don't want, any sort of negative background on that stuff. But at the same time, you got to think from a user's perspective, you kind of want to know what's running it, because I definitely have qualms with different AI models like Inflections Pi that I've talked at length ad nauseum about. But so I think this is kind of interesting. There's probably going to come to this point where consumers want to know, and companies for that reason don't want to tell, because maybe one technology is better or they have better partnership over there. So anyways, I just think it's going to be an interesting field in that regard.
Yeah, it's interesting. Yeah, I was thinking about that a lot. So I was at SAP Sapphire earlier in the year, and I got to kind of go backstage and talk to some of the designers of all this. And I was asking them, you're using, if you're partnering with like Amazon Web Services, AWS, Bedrock, for example, with these tools, you get to choose which, do you want to use ChatGPT? Do you want to use Claude, Gemini, Llama 3, whatever it is? And my question to them was, well, consumers aren't going to know which one is the best one. So how do you optimize it? He's like, well, we have our own benchmarking and optimization, everything else. And I bring that up to say that even if people don't know which model to use, you're right. That's something like Huma, unless I can't think of a way that it would bounce around from different models. It wouldn't make sense in this case. But I'm still waiting for that moment, Jaden. And at some point, we're going to create a mega podcast on this. I have not yet seen the giant blow up moment. Gemini's had a couple, right? Back in whatever it was, February or March of 2023, when it tried to do that demo. And then again in December, when it tried to do a demo again. Google had a lot of bad luck. I think Gemini's really doing very, very well right now. But we haven't sort of had to, defend a model yet. We haven't had sort of the big model that blew up the big thing and got something really, really wrong that made it into such national news that everybody's like 10-foot pole, not even going near that thing. So I think you're right. I think that they have to be careful, because maybe I'm looking at the negative side rather than the positive side, less so than people saying, well, I'd really prefer this model over this. They'll just know, well, I don't know. All I did is, I read in the news that this thing hallucinated. So what are you using? And that's the danger to me, right?
It's kind of interesting. Not to go on a total tangent, but I think it does have a real side effect. And I think this is an interesting concept for people to be aware of. But you see the same kind of thing play out with like I'm in the process of traveling. I'm going to be going to France next week. So it's like obviously top of mind. But like when you think of like Boeing and a lot of every time there's like some sort of big debacle with Boeing, I got a friend that works in their like crisis department there. It's always fun talking to him. But anytime there's a big crisis with Boeing, there's people that are going on certain travel sites and looking up what Boeing airplane their flight is on and avoiding. Like I have friends that are like, they will literally avoid certain routes, even if it's slightly cheaper, because they're like, oh, I don't want to fly on that kind of Boeing. That's the one that, always has problems or whatever. And I mean, obviously Boeing's seems like they're kind of getting their crap figured out or whatever. There's drama, whatever. I'm not really commenting on Boeing. I just think this concept will probably play over to AI models as well, where when you have these bad PR things, this will happen. So it's just an interesting thing as a side note, not really the main topic here. Overall,
no, but but I think it actually is. It's an interesting topic, and it's going to come up. We are going to be waiting, Jaden. We're marking this podcast at some point. Something's going to blow up. But I'm glad you brought this one up because we love the healthcare space. There, generative AI, guys, in healthcare, it's unbelievable everything that it can do, just from saving doctors time in paperwork and non-value-added tasks to drug discovery to everything else. And so if Huma can get this power in the hands of the everyday user, I think that we are going to see some incredible gains over the next 12 months or so.
100%. Listen, everyone, thank you so much for tuning into the podcast today. Thank you so much for helping us cross 100 reviews recently. If you wouldn't mind dropping us a review, if you love the podcast, we would be thrilled. We really do appreciate them all. Last thing I want to say is make sure you're subscribed to Connor's newsletter. There is big news coming out from Connor soon. I'm not even going to get close to what it is, but you'll be excited to hear. So please make your subscribe to his newsletter. The link will be in the description. But otherwise, hope that you all have an amazing rest of your day.